Krishna Chaitanya sir, good morning sir. Krishna Chaitanya sir.
Yeah, hello, good morning. Good morning.
Sir. Sir,
Good morning, sir.
Yes, sir. You can share now, sir.
Okay.
Just now, just.
Okay. Can I share the screen, sir?
Yes, sir.
Okay.
Sir, please remove pen tool, sir.
Yeah, I'm doing it.
Go to more.
Okay.
Disable the participant animation.
Disable participants annotation.
Yes, sir. Yes, sir. Now okay, sir.
It's visible, right?
Yes, sir. You can stop the session, sir.
Okay. Shall I start?
No, sir.
Yeah, that's what.
Seen the same, sir.
Okay.
Now technically okay, sir. Sir, you can stop this sharing, sir.
Okay.
A very good morning to one and all. I welcome you all to the fifth day of student program on role of pharmacy teachers, a holistic approach to create an end product of education, be a free creative man. Now I request Pranati for further proceedings. Over to Pranati.
Thank you, sir. Confidence and hard work are the best medicine to kill the disease called failure. It will make you a very successful person. Good morning, everyone. With this positive attitude, I, Pranati, welcome you all to the fifth day session of 1 week student enhancement program on role of pharmacy teachers, a holistic approach to create an end product of education, be a creative man, organized by Department of Pharmaceutical Analysis in association with IPA, AP State Branch, and BPCV Alumni Association. Without any further delay, let us start today's session by Dr. A. Krishna Chaitanya Garu, Assistant Professor, Department of Biochemistry and Bioinformatics, Geetham, deemed to be University, Visakhapatnam, on the topic Therapeutic and Diagnostic Applications of Enzymes. I invite Tejasri to read out the profile of Dr. A. Krishna Chaitanya Garu.
Thank you, Pranati. Good morning, all. I am Tejasri. I am honored to read out the profile of Dr. Amajala Krishna Chaitanya Garu. He completed his MSc Biochemistry at Andhra University, Visakhapatnam in the year 2007. APGD Bioinformatics at Pondicherry University, Puducherry in the year 2008 and PhD Biochemistry at Geetham University, Visakhapatnam in the year 2016. He has total 11 years of teaching experience and research experience. He completed his UGC minor research project during the years of 2013 to 15 and an ongoing research project on DAE UGC consortium. He completed 3 dissertation research projects. He published around 25 research publications on gene reports, New Journal of Chemistry, Algorithms Research, Drug Information Today, and etc. He is guiding 2 PhD degree students at Geetham University. He received several professional recognitions and summer research fellowship in the year 2016. He is also awarded with many certificates, societal memberships, academic recognitions. He participated in 9 international and 32 national conferences, seminars, workshops, and events. He attended around 8 refresher programs and 16 guest lectures. He guided 26 MSc Bioinformatics student projects. At present, he is working as an assistant professor in Bioinformatics and Biochemistry Department at Geetham Institute of Science, Geetham deemed to be University, Visakhapatnam. Sir, we are privileged to have you here for today's session. We request you to start your session, sir.
Yeah. Thank you, Pranati Garu. Can I share the screen? No?
Yes, sir.
Yeah. Is it visible, Ashok sir?
Yes, sir. Yes, sir.
Okay. A very hearty good morning to one and everyone. So I am Krishna Chaitanya from Department of Biochemistry and Informatics. That already have gave an insight about me by Pranati Madam regarding me. So I am from Geetham, Visakhapatnam, and my areas of interest are majorly from the bioinformatics side, and I also contribute some of the teachings as well as the research in the biochemistry. So today, my presentation is all about to give an insight about like what are the therapeutic applications and diagnostic applications of enzymes. Enzymes do a very lot of work, and we try to see like what kind of job they do inside a cell. But before, prior to really starting of the session, I would like to greet and thanks a lot to the entire team of this particular student enhancement program, especially the organizing members, Rathai sir and Krishna Devarailu sir and the chief guest, as well special mention to Professor Ravi Shankar sir, which HOD of the your department for pharmaceutical analysis, and the Rajeshwar sir and the Srinivas Babu Garu and co-conveners, as well as and thanks, a very good thanks to organizer secretary Ashok sir for providing and giving me an opportunity to share some of the content relevant to this particular workshop or relevant to this particular enhancement program. So at least I expect at least 10 to 20% of the good thing what you can grab right today at this moment. That I would much more happy to really contribute into this program. Uh, so this coming to the outline of this presentation. So my presentation will be dealing with a small bit of what the enzymes are. I specifically no need to define like what the enzymes are, and we'll see there like what the principal components and what are the therapeutic role of enzymes, and what their applications, and what are the diagnostics, in what way the enzymes help out in the act as the diagnostic markers, and what are their applications. So there will be an extensive text will be there, but I'll try to I manage and made it to cut short to understand in a very good manner, as these are the very extensive data is available all over in the internet. So let me just in overview just talk about like enzymes. So you all know like what the enzymes are. So it is one kind of what to say the protein molecule or a specific biomolecule, which we also call as biocatalysts. So they are involved in the reactions, especially the biochemical reactions. So there are, when you really look into the components of an enzyme, the enzymes are of two kinds, like simple enzymes or the simple proteins, or majority of the enzymes are the complex, or we simply call as enzymes, which consisting of two parts: the protein part, which is called as apoenzyme, and the non-protein part, that is called as cofactor. Okay, so when you really look about the cofactors somewhere, am I audible? Is it fine?
Yes, sir. Yes, sir.
Okay, yeah. Okay, so there are certain things in the in the cofactors where we call it as prosthetic groups, and where we call as coenzymes. Okay, so prosthetic groups are something like inorganic molecule type, which are tightly bound to the coenzyme protein part, whereas the coenzyme is an organic kind of molecule which is loosely bound to the protein part of an enzyme. So moving on to the directly into the therapeutics concept without any background of the enzymes. So you possibly must be knowing what are the factors that really contribute for the right enzyme action. So factors like temperature, factors like pH, factor like substrate concentration, even the product concentration. All these are the various factors. They actually communicate with your enzyme and try to do the action. I mean, try to make the function of the particular enzyme. So in what way the enzymes are involved in the therapeutics? Therapeutics, the word itself is something for the treatment or something for the medication. Okay. Okay, so how the enzymes really play a contributing role in the therapeutics, that we will see. So usually the enzymes have two wonderful features that they differentiate from the drugs. See, for the medication can be in the form of drugs, which are quite common today. Everyone is the one kind of, medication is in the form of drugs, or medication in the form of vaccination, and the medications can be in this form of enzymes also. Okay, so there are two important features are there. The first feature is like the enzymes frequently bind and act on their targeted sites. Even the drugs are also have the specific targeting site, but compared to the drug molecules, the enzyme molecules will have high affinity and the high specificity. That is the one important feature. The second important feature is like they are the catalytic in nature and convert numerous target molecules to the desired products. A drug molecule do not do that job. A drug molecule cannot do the catalytic function, but an enzyme can do the catalytic function, and it can modify your target molecule into some desired product. That is the benefit of the what you say, the enzymes features. Okay, so these two are the important features which makes the enzymes a very specific and potent drug kind of molecules which can achieve the best therapeutic biochemistry in the body where the small molecules cannot do. That is a major advantage. But let us see like how many type of enzymes are there, what kind of enzymes are there which are being used as therapeutics. Okay, so there are so many number of enzymes are there uh, which have their major features. These are the quite advantage kind of point where they are important in the use of as therapeutics. Number one is like they have a very high specificity to their substrates, and the second is like they are proficient in producing the desired effect without any side effects. The side effects is a one of the biggest hurdle in the drugs. Okay, the drug molecules show so many number of side effects, even though some are noticeable, some are non-noticeable, but a drug every time have a definitely a side effect will be there. But majority of the therapeutic enzymes, they do not have such kind of side effects where the drug molecule shows. And majority of the drug enzymes are also water soluble, which makes it very flexible to do the function within the cell. And they are extremely effective in a biological environment when compared to your drug molecules. So these are the four important features or the four important advantages where the enzymes can be used as the therapeutics. Okay, so the disadvantages, but even though the advantages are there, there are some of the serious disadvantages are there to fail. The therapeutic strategy or therapeutic role of an enzyme can fail because some of the very important properties. Number one is like when compared to the drug, the enzyme is a very large molecule. It is a very bulky structure because your enzyme is composed of the protein molecule, the protein moieties. All the amino acids together make the your enzyme as a bulk, and it's a very large molecular weight. Okay, so certainly the molecular weight will be greater than 500 daltons, whereas all the chemical molecules, whatever the medicines we do take, they will be certainly will be less than 500 daltons in weight. So that is the reason they are excluded them from the intracellular domain. So intracellular uptake is quite tough for the enzymes. That is the one disadvantage. Number two is they are high proteinaceous in nature because enzymes are made up of amino acids. They are made up of amino acids, and they are absolute protein in nature, which can be act as antigenic. Okay, they can be act as antigenic so that the immune responses generate towards the therapeutic enzyme, and that's why they are rapidly cleared from the blood plasma. That is the second disadvantage what we face in the enzymes. And the third point is like extensive purification is required because the isolation, the characterization, the purification of the proteins itself is a very complicated task. You require a very precise kind of conditions as per the protocols to really purify your enzyme in a very good quality form. So that's why it results in a very higher production cost. But these are the some of the limitations or the drawbacks where the enzymes cannot be used as a therapeutics. But there are so many. Even though these three are the some of the serious limitations. We got so many number of enzymes, what we'll shortly see in the next slides, coming slides. Okay. So what are the therapeutic applications? So there are plenty. Even I wondered when I'm really looking the content about this particular topic in these past 2-3 days. So I'll be discussing in 4 different areas and 5 different areas. Number one is enzymes in metabolic disorders. So what type of enzymes are involved and what type of enzymes are responsible for the metabolic disorders. So how we tackle that particular metabolic disorder to deal with the particular metabolic disorder. Okay, that we will discuss in a tabular form. And what are the enzymes that are involved in the cancer therapy, which can act as therapeutics, and what enzymes in the thrombolytic treatment or the cardiovascular diseases. Thrombolytics and the cardiovascular are linked. Okay, what the link is, that we will try to understand. And the enzymes in the digestive disorders and the inflammations, and that we will focus. And lastly, we will talk about like enzymes in the cystic fibrosis, Alzheimer's treatment, and the nicotine cessation, nicotine stoppage. So how all in all these 5 different areas, how your enzymes can act as the treatment molecules, how they are involved in the cure of that particular disease, that we are going to see. So number one is like metabolic disorders, we'll try to understand. So the defects in the enzymes involved in the metabolic pathways, you know what the metabolic pathway is. So metabolic pathways are of 2 types, catabolic and the anabolic. So in almost every of the pathway, the enzyme participation is necessary. If there is a defect in any one particular enzyme in any of the pathway, that will lead to the pathological condition. Majority of the metabolic disorders are due to the mutation in an enzyme. Okay, there is a simple, you cannot even imagine such one small change of a mutation leads to a drastic condition in the a drastic condition of the disorders. So there are 2 ways. Number one is like enzyme replacement. The other one is something like structure stabilizers. So these are the things what you can do in the form of therapeutics. Enzyme replacement means some enzyme activity is going to be lost or impaired, or some deficiency of enzyme will be there. So you are going to substitute that particular enzyme to this. Okay. So in any metabolic pathway, if some enzyme is got lost or is deficient, so you are going to replace that. You are going to replace that enzyme through external. You are going to implement that. So that is what called ERT, enzyme replacement therapy. And in cases of enzyme replacement therapy, if this doesn't work, then we try to go with the other alternative, that is what called pharmacological chaperones. Chaperones are the proteins which assist the folding. Okay, they assist your protein folding. Usually there are some kind of mutations which actually do not make your proteins fold properly. Okay, so the folding of the protein will not proper and leads to the disorder and leads to the inactivity of the function. Okay, so you put some kind of proteins, pharmacological chaperones, which assist your protein fold in a right way, and which the protein will do its job in an active form. That is what the role of structure stabilizers. Okay, so these are the 2 different ways where you can utilize the enzymes in the metabolic disorders. So let us see. Probably I'll be discussing about 11 type of disorders in this current session. Okay, there are so many number of metabolic disorders, but for the 11 type of disorders, we have an answer from the enzymes from the enzymes part. Okay. So what are those? Number one is phenylketonuria. I think everybody are aware about what the phenylketonuria is all about. So what happens in that is there is a heavy accumulation of phenylalanine in the body. Okay, so once the phenylalanine is heavily accumulated, there is a damage of the tissues. There will be a damage of the behavior. There will be a alternative behavior problems, and there can be a chance of mental disorders will also be there. So why this is happening? What is the reason for such kind of accumulation being there is a loss of an enzyme called as phenylalanine hydroxylase. Okay, there is a loss or the impairment of an enzyme called as phenylalanine hydroxylase. See, majority of the deficiencies or loss are due to because of the mutations. You have to only simple one point. Majorly, majority of the metabolic disorders happen only because of the mutations in the enzyme molecule. Okay, so how the mutations occur and where the mutations occur, that depends. That depends upon the factors, various factors, including the environmental factors, including the genetic system, including the hereditary problems. So many factors are also there contributing for the mutations. So what is the therapeutic agent over there? So how you are going to tackle this particular metabolic disorder, that is phenylketonuria. So there is an enzyme called PLA, that is phenylalanine ammoniolase. So this is a externally you are going to give, intravenously you are going to give to that particular patient who is exhibiting the phenylketonuria problem. So what it does is it will convert the whatever the accumulated phenylalanine to the TCA and the ammonia, okay, to the TCA transamine ammonia acid and the ammonia. So in this way, the accumulation of the L-phenylalanine is going to be handled. That is the first metabolic disorder. And the second kind of metabolic disorder is called as Morquio syndrome. They are also called as mucopolysaccharidosis type 4. Okay, so there are so many types of mucopolysaccharidosis we will come across. This is the type 4. There are 3 or 4 types of disorders are there, especially we're trying to understand that. So what happens over here is there will be no degradation of glycoaminoglycosides. Okay, glucoaminoglycosides degradation will not happen, and leading to the accumulation of keratin sulfate and the chondroitin 6 sulfate. So this happens in this particular syndrome. So why? Because there is a loss of an enzyme, lysosomal enzyme called as GALNS, that is N-acetyl galactosamine 6 sulfate sulfatase. This enzyme cannot perform its job, and that leads to the accumulation of this. Okay, so there is an enzyme called as edosulfase. It is a synthetic version which is an identical to the human enzyme that has been synthesized from the recombinant DNA technology, and that's been in the use. That's been as a therapeutic answer for this particular syndrome. The third kind of syndrome is the Sanfilippo A. It's called as MPS type 3A. This is the type 4 and the type 3A. It's again due to loss of the enzyme called as sulfoglucosamine. So you are using another kind of recombinant enzyme which actually provide you an answer to this particular metabolic disorder. The another one is Pompe disease. It is like the accumulation of glycogen in almost every of the tissues, especially in the cardiac and the skeletal muscles. Okay, that is only because of the loss of an enzyme, lysosomal enzyme. If you try to observe very carefully, majority of the enzymes are the lysosomal enzymes. Okay, the lysozyme is a hot center for many number of enzymes, and these enzymes get lost or they are deficit in nature, leading to the disorders. Okay, so we have an enzyme called as GAA, where the loss of the GAA leads to the muscle weakness, poor muscle tone, and the enlarged liver, hepatomegaly happens, and the heart defects can also happen in this particular disease. So there is a recombinant of human enzyme is there, so where you can use it as an enzyme replacement therapy. So almost wherever the recombinant DNA technology has come, all are the enzyme replacement therapy based kind of enzymes. Okay, so what is the fifth kind of disorder? What we try to address is, it is again the MPC type 6. It's called as Maroteaux-Slamy syndrome. It is an accumulation of glycose aminoglycans. Actually, I cannot put like where the mutations are happening and why the mutations happened and what resulting in the mutation. So everything is there in the literature, but I cannot put over here because of the very extensive data. Okay, so there is a loss of an enzyme called as aryl sulfatase B, and you have a therapeutic agent called as naglazine or the gal sulfase, which is again a recombinant kind of molecule where you try to address this particular problem. Gaucher's disease is quite very common problem. It is the most common autosomal recessive lysosomal storage disease, and it is the heavy accumulation of glucose erythrocyte kind of molecule in the tissue macrophages, in the spleen, in the liver, and in the skeletal, and leading to the skeletal and neurological complications. So that is a very serious problem. Actually, the GD, there are three types of GD are there. Especially the first type can only be curable, whereas the second type GD2 and GD3 cannot be curable because they absolutely show the complete neurological complications. Okay, there will be heavy neurological complications where your whatever the therapeutic molecule we try to give, it cannot be solved this particular problem. Actually, there are 300 type of mutations have observed, especially for the resulting of the Gaucher disease. The 300 mutations in the particular protein called as acid B glucosidase. There are so many number of mutations got accumulated, resulting in the such kind of implications. Okay, so only GD1 can be answered. GD1 can be treated by the two effective enzyme replacement therapies, one called as Serizyme and the other one is called Viprib for the GD1, and another one is called as plant-derived ERT is also available. They are only for the treatment of first type of GD disease. The second kind of enzyme metabolic disorder, the seventh one is the Fabry disease. It is called, it is like heavy accumulation of the fat. This is a different type of fat is going to be accumulated all over the body, and that is only because of the loss of an enzyme called as alpha galactosidase A. So there is an enzyme replacement called as Fabrazyme, where you can provide the alternative to this particular syndrome disease. So coming to the last about the enzymes in the metabolic disorders, the Krabbe disease, where the neurodegenerative disorder happens, it is again a defect in the lysosomal enzyme GALC, that is galactoserythrosidase. Okay, so this loss of enzyme leads to the heavy loss of myelin sheath. So demyelination occurs in the entire nerve cells of the body. That leads to the absolute collapse of the communication in the Krabbe disease. So there is an alternative called as PCT. Here we cannot use the enzyme replacement therapy. We can use the alternative strategy called as pharmaceutical chaperone therapy. So you are going to put the some chaperone proteins so that they will assist in the folding of the enzyme GALC protein. Okay, they assist in the GALC folding, because enzyme therapy fails in this case, in this particular disorder. And coming to the Hunter syndrome, that is MPS type 2, that is mucopolysaccharidosis type 2, there will be no lysosomal degradation of the dermatan sulfate and heparan sulfate. They again leads to the cardiac and the neurological deterioration that happens in this case. So that is because of the enzyme iduronate 2 sulfatase. See the enzymes role. So far we have seen the 9 number of metabolic disorders, and almost 9 different type of enzymes are involved in particular disorders, in all these 9 disorders. But we are trying to really answer through the therapeutic way by the again with the enzyme only. So we are not using any kind of drug to really tackle these disorders. We are using the recombinant form of enzymes to really tackle this disorders. Okay, so there is an elaprase, which is a purified form of IDS by the recombinant technology. So Hurler syndrome is about the MPS 1 and Sly syndrome is about MPS 7. So they both are involved, almost a similar kind of skeletal abnormalities are going to be observed, and there are chances of the heart diseases, there are chances of the enlarged liver and spleen. See, almost every are interlinked, especially what they impact on the heart, they impact on the liver, they impact on the spleen, they impact on the pancreas. Even wherever you really see, everything are co-linked, especially in this particular enzyme subject, when you try to understand the enzyme subject. So that is because of the deficiency in the enzyme, and we have an human IDUA by the recombinant technology, whereas the SLICE syndrome is because of the deficiency of an enzyme called as beta glucuronidase. We have a westronidase kind of recombinant form of human beta glucuronidase. So these are the some specific metabolic disorders where we can really handle with the enzymatic therapeutic disorders. Coming to the cancer therapy, here actually the current investigations and current research are exclusively dealing about the organic molecules. Of course, organic molecules are plenty of them to really analyze the biological activity, but people now are trying to really look the peptide molecules, peptide moieties. Now they are into the peptides, and they are now into the MAPs, monoclonal antibodies. Monoclonal antibodies also they are trying to address for the cancer therapies. But we have the enzymes. Some of the enzymes are also available, but they are not really to the up to the mark currently nowadays. Even though they act in a very primary stages, but there are some of the limitations over there, especially in the cancer therapy. But that's why even the drugs have so many number of side effects are there. So people are trying to really go ahead with the MAPs as for the some of the peptide based molecules. So you have a combination of a protein and a combination of some carbohydrate. So glycopeptide kind of molecules are also being in the research for the cancer therapy. So let us see like what enzymes so far reported in the current literature, which are evidenced as the anti-tumor agents. So number one is like you got around 10 to 12 number of enzymes are there, like L-serine dehydratase, arginase, L-asparginase, methionase, glutaminase, tyrosinase. So there are so many, and each got its role in regulating the tumor cell or in regulating the pathways. Usually the cancer cells are high in the metabolic activity. Usually they are high in the metabolic activity, and you try to put those regulation into control by these enzymes. That's what we are going to see. So one example we'll try to understand asparginase. But what are the advantage when coming to the using these particular enzymes in the cancer therapy? Number one is like it reduces the adverse effects caused by the radiotherapy and the chemotherapy. So cancer is really a treatable disease which involves of the radiotherapy and the chemo, which have the heavy side effects and the very adverse side effects. And there is a lot of anti-inflammatory potential is there, whereas the radiotherapy and chemotherapies or whatever the drugs, they have some of the side effects in the form of inflammation. But the enzymes can overcome these two major problems. Number one is you can avoid the side effects based on the radiotherapy and chemo, and you can also have the anti-inflammatory potential that can be shown by the enzymes in the cancer therapy. So let us see like only one example, that is the asparginase. It was most widely investigated enzyme, and basically it was involved in treating these types of leukemias. Especially they try to answer this great type of leukemias. So basically the cancerous cells deprives the cells of their nutritional asparagine supply. So, okay, so asparagine is very essential for the protein synthesis, and the decreased protein synthesis leads to the immunosuppression and toxic effects. So you try to really give this particular enzyme as a cancer therapy so that you can subside the toxic effects inside a cancer cell. So usually, but there is an again difficulty, especially there is a antigenicity problem will be there, and a very short circulation time will be there for the effective action of the enzyme. So these are some of the two problems what we come across the enzymes treatment in the cancer especially. So moving on to the third, that is the therapeutic enzymes in the thrombolytic treatment or the cardiovascular. So thrombolytic treatment is something basing on the clots, okay, something relevant to the clotting factors and every of the other kind of proteins involved in the entire clotting pathways. So we already know, like, there is a cascade of reactions happens in the clotting, in the clot formation, or in the clot breakdown. So these are the important integrated pathways are there, which are also linked to the cardiovascular. So number one, so usually in the normal physiological conditions, there is an equilibrium between the blood coagulation factors and the fibrinolysis. So this is what normally there should be a balance. There should be a balance, or there should be equilibrium between the two type of pathways, coagulation or the coagulation breakdown. Okay, so the enzymes, so many kind of enzymes, so many type of ribozymes, so many type of activators, pro-activators are involved or responsible for maintaining this equilibrium. Once this equilibrium get altered, once this equilibrium get altered, then nobody can really stop what the damage happens inside the blood vessels or wherever the location it is. So the loss of homeostatic or the equilibrium balance can be restored by the administration of the enzymes. Okay, that's what you use the enzymes. Even the surgeries or the chemical molecules, the drugs cannot do the best job than the enzymes. So enzymes do the best job to really maintain this homeostatic equilibrium. Okay, that's what you are going to give through the intravenous injection, especially in the dealing with the cardiovascular diseases. So this kind of treatment is called as therapeutic thrombolysis, or it's also called as thrombolytic therapy, or it's also simply called as clot breakdown. So wherever the clots are there, you are going to break down the clots inside the blood vessels by the administration of the enzymes. Okay, so even though if you try to remove the clot by the surgeries, there are a heavy chances of forming of another clots or clots at some other sites, or heavy chances of inflammation at the surgery site. These are some of the complications because of the surgery. So that's why the people prefer to go with the enzyme based treatments, especially to remove the clots inside the body. So the novel thrombolytic agents are existing. They have been derived from the various sources. There are plenty of sources are there, like the bacteria. The most popular one is usage of the streptokinase from the bacterial cells, and the venom of the viper is called as albin, and the filamentous fungus based molecules are there, and the South American snake based, we call it as reptilase. And the human urine, urokinase is one kind of enzyme where we find in the urine, but this is a very high productive cost is there in the urine. Around in the 2000 liters of the content, around 20 mg we hardly get. So you cannot use the 20 mg. That is one of the basic disadvantage of the urokinase. Okay, so urokinase is good, but it is involved of very high manufacturing cost when compared to the are more focused on the treatment of occlusions. They are nothing but the clots in the blood vessels. So usually they lead to the life-threatening conditions called as myocardial infarction and the massive pulmonary embolism. So these are some of the important kind of life-threatening conditions which may happen because of the clots. So we take the streptokinase accompanied with the heparin. Heparin is an acting as an anticoagulant agent, is considered as an effective way of treating the clots. So among all the thrombolytic agents, streptokinase is the most favorable kind of molecule to treat the cardiovascular diseases. So moving on to the fourth, that is the therapeutic enzymes in the digestive disorders and the inflammations. So there are certain set of enzymes which try to address the digestive disorders. So what are those? So I'll try to just simplify this particular tabular form. So what enzymes are, and from where the enzymes are used, and when they are used, for what we are going to use. So papain and fungal extracts are from the Aspergillus species. What they do is they enhance the absorption of the food or whatever the content from the small intestine. So they enhance the absorption property from the small intestine. Those are the papain and the fungal extracts. And oral beta galactosidase, that is a really a very wonderful kind of molecule which helps a lot for the people or for the children who have lactose intolerance. I mean, they cannot digest the lactose which is present in the milk because of the lacking of the intestinal disease called as lactose deficiency. So you try to get the molecule beta galactosidase from the Aspergillus species, and those people can orally take this particular molecule so that they can easily digest the lactose present in the milk. Okay, that is one kind of a very important application about the therapeutic enzyme. And the penicillinase is an enzyme produced from the Bacillus subtilis. They are involved in the treating the hypersensitivity reactions caused by the antibiotic penicillin. Some people have the show the hypersensitive reaction for the penicillin when they are administered. So in those cases, they have to take the combinatorial medication along, that is called as penicillinase. And hydrolases from the microbes and plants, they decrease the inflammation and edema. And the bromelain, it is from the pineapple, which helps in the breakdown of the proteins. And the pancreatin, again from the animal pancreas, they help in the digestion of the starch and the proteins in the patients, especially suffering from the pancreatic cyst and the pancreatitis. So these are some of the inflammations or some of the digestive disorders where we can address by using the enzymes. Okay, so with that, I think we are almost about to end about the therapeutic applications about the enzymes. So far, we discussed about like the enzymes involved in the metabolic disorders, the enzymes involved in the cancer therapy, enzymes involved in the what we say the thrombolytic or the cardiovascular, and lastly about the enzymes in the inflammation or the gastric kind of problems. And the fifth is like enzymes involved in the CF, Alzheimer's, and the nicotine. What those enzymes are? Let us see. So the cystic fibrosis is like it is a typical kind of disease where actually there is a defect in the mutation called as CFTR. Okay, there is a mutation in this particular CFTR which is called as cystic fibrosis transmembrane conductance. What it does is it actually produces a thick mucus. Okay, the body produces thick and sticky mucus inside the respiratory system, which leads to the obstruction and clogging of the lungs. The children or the people who suffers from the CF, they have a very short lifespan, especially because they cannot take up the air, they cannot take up the food properly, and that is only a small mutation in a gene, the CFTR. But there is a really a very perfect molecule called as dorlase, which is a recombinant human deoxyribonuclease, which actually reduces the viscosity of the sputum in the airways of the CF patients. So a thick mucus can be made as a thin mucus by using this particular molecule. They orally take this particular enzyme where it try to make the clogging of the lungs to be free. Okay, that's a really a wonderful blessing for those people, especially the people who are suffering for those CF. And the second is the Alzheimer's disease. Till date, there is nothing to really answer the Alzheimer's disease. There is a heavy accumulation of a protein called amyloid beta in the brain. So the brain is entirely made up of communication nerves. So all these nerves get damaged because of the accumulation of a protein called A beta, that is called as amyloid beta. So there is a formation of the plaques by beta amyloids, and there can be a formation of the tangles by tau proteins. Actually, they are the very good proteins. They do the job to maintain the nerve cells, but heavy generation and controllable synthesis of those proteins leads to the damage of the brain cells. So actually, in the recent literature, there is a molecule called neprilysin. That was what they are suggested to really go with the Alzheimer's treatment. but nothing are really the good kind of outcomes have come so far by the neprilysin. So it is an enzyme which has to receive the attention, so that they did a modification of the neprilysin to really do the treat the Alzheimer's disease. And the last is like nicotine cessation, the tobacco smoking. So tobacco smoking leads to the cancer and the cardiovascular disease. We all know that, but there is a chance. One of the research people team has proposed that Pseudomonas putida is coding for one particular enzyme called as flavin containing enzyme NICAT, where it can convert your nicotine. It can convert your nicotine to the N-methyl myosin. So it was suggested that so the people can really the people who are addicted, especially nicotine immediately enters into the brain within very short span of seconds, so nobody can control the addiction over there. So by this was a suggested kind of research, not yet done completely. So we have an option to really stop the usage of the nicotine. That is some of the enzymes what we come across over here. So till now we have tried to address the some of the diseases or some of the syndromes or some of the disorders by the enzymes. So there are plenty number of enzymes. Possibly I have mentioned around 15 to 20 number of enzymes right now, but many more are there to really deal with the many kind of syndromes as well as disorders. Now let us see the role of enzymes in the diagnostics. So in what way the enzymes help you out in the diagnosis, that we'll try to understand right now. So the diagnostic applications of enzymes widely vary from immunoassays to the biosensors. So everywhere almost the diagnostic kits, whatever we see in the outside and whatever we see in the biosensors, especially to detect any kind of antigen or to detect any kind of molecule, we use the enzymes a lot. So the examination of the enzyme quantity, especially, we are trying to look the enzyme quantity in the extracellular body fluids are vital. We are trying to see like what are the concentrations ranges or what levels are high, what levels are low. They are really helpful in diagnosing the clinical conditions or the management of the diseases. So the fluids, what are the different fluids we try to make an examination? Number one is like very common, that is like blood plasma on the serum, and the number two is the urine, and the three is the digestive juices, and the fourth is amniotic fluid, and the fifth is the cerebrospinal fluid. These are the various fluids in the body where they actually really help you a lot, because they contain so many number of enzymes which we may call them as markers for particular clinical conditions that we can very perfectly identify. So why this happens? How the enzymes can really observed as the markers? Usually in the normal cells, many of the enzymes will be doing their job as simple as such. But if there is any imbalance, metabolic imbalance occurs in the cell by either the infective agents or the bacterial toxins or any other kind of conditions, the enzymes will. So there where we actually detect the enzymes because of some damage or some imbalance that may occur within the cells. So this causes their fluid level to be raised above the normal cell level. So we will see like what enzymes can be used in the different conditions. So enzyme assays play a very important contribution in the diagnosis of diseases, especially to really identify what the disease is. Enzymes play a very important role, and it is a quite safe kind of diagnosis, and it also ensures us to really take care in the future also because of the enzymes only. Okay, without enzymes we cannot really have an idea like what disease is existing within us. So the enzymes which are used for the detection or the diagnosis or the prognosis They are called as diagnostic enzymes. So we'll be dealing about the enzymes in the liver diseases, and we will deal some of the enzymes in the cancer, and enzymes in the cardiac disorders. So these three we are going to discuss now. So what enzymes are involved in the liver? I mean, responsible for the liver disease. What enzymes are responsible for the cancer? I mean, what enzymes are responsible for the cardiac disorders as the diagnostics that we are going to see. Yeah. So enzymes in the liver diseases, possibly everybody must be knowing. Like liver is the largest internal organ. It does a plenty of job. None of the organ really works like liver. So it detoxifies the blood. It detoxifies the cholesterol. It has a role in the glucose function and the iron metabolism. So the conditions of the liver, like hepatitis or EBV infection or the fatty liver or excessive intake of alcohol and drugs like acetaminophen, results in the abnormal functioning. So all this abnormal functioning will be shown in the form of, will show an impact on the enzymes. There are two kind of enzymes especially. So there are so many number of enzymes are going to be released into the bloodstream and say to the cell that something is a problem within the liver system. Okay, there is a problem in the liver system. That's why the enzymes are going to be rise like anything. The level of the enzymes rise like anything to really tackle the condition within the body. So what are those enzymes? Now, usually there are very popular kind of enzymes called as aminotransferases. In that, there are two type of enzymes, that is the ALT, alanine aminotransferase, and aspartate aminotransferase, where they involved in the transfer of amino groups. So simply what the catalytic function about that particular enzyme is, the ALT do what it does, it converts the L-alanine and the 2-oxoglutamate to the pyruvate and the glutamate. Whereas the aminotransferase, aspartate aminotransferase, what it does is it converts the L-aspartic and 2-oxoglutamate to the oxaloacetate and the glutamate. So these are the simplified reactions, very simple reactions, what we come across by these enzymes. The normal concentrations are around 5 to 35 and 5 to 40, but during the conditions of any damaged disease of liver or the heart and muscle, these concentrations are going to rise a lot, and around 10 to 20 times of rise will be displayed, especially if there is a heavy damage in the heart and liver as well the muscle. These are some of the enzymes from the liver, and there is another kind of enzyme in the alkaline phosphatase, where it hydrolyzes the phosphate ester bonds in alkaline environment. They also rise in the level, which indicates the cholestatic diseases as well. It will also tell you about the bile function. So the biliary actions can be diagnosed by this particular enzyme called as alkaline phosphatase. The third is the GGT, that is a gamma glutamine transferase. They help in the transport of amino acids from one peptide to another. So they have plenty of markers. This enzyme play a role of plenty number of marking suggestions for us to implicate about the disease. So it acts as an important biomarker in hepatobiliary disease. It also, the blockage leads to the 5 to 30 times the rise of this particular enzyme, and it also involves in the indication of the hyperthyroidism, RA, rheumatoid arthritis, and the obstructive pulmonary disease and the myotonic dystrophy. So other than the liver, they will also try to, this particular enzyme try to also figure out the other kind of clinical conditions like hypothyroidism. Even the GGT to platelet ratio index, they also present you the novel marker of liver fibrosis in the patients with the chronic hepatitis. So the liver has so many kind of enzymes, especially these three enzymes, aminotransferases, alkaline phosphatase, and the gamma glutamyl transferase. These three are the very primary prognostic diagnostic markers, especially to tell you about the function of the liver, to tell you about the what is the functional status of the liver. What are the enzymes in the cancer? Like what enzymes are there to reveal about the cancer? There are so many number of enzymes are there because actually the cancer is like it's uncontrollable proliferation of the cells. When there is an uncontrollable proliferation of the cells, there is heavy activity of many kind of genes, many kind of proteins, and many kind of enzymes. So obviously there are so many number of enzymes can act as markers in the cancer cell. So, but some of the major already which are in the testing, which are already tested. Number one is like acid phosphatases. There are 5 types of acid phosphatases are existing. They are specific to specific cell like prostate and the erythrocytes and the macrophages and the lysosomes and the osteoclastics. So basically, the prostatic acid phosphatase is heavily found in the prostate cells. Okay, that if the prostate cells are having the high content of prostatic acid phosphatase enzyme, that indicates that it is a prostate cancer. It can be a chance signs of a prostate cancer. The second is the cathepsin D. The role of the cathepsin D is to lyse the proteins within the cell into various fragments, but that cathepsin is overexpressed in the breast cancer cells and contributes to the breast cancer. So to diagnose a breast cancer, possibly the cathepsin D diagnosed can be took as a diagnostic marker, especially in this particular scenario. And there is a third kind of enzyme name, that is the cysteine cathepsins. There are 11 types of cysteine cathepsins are there, where they actually are highly upregulated in all the types of cancers, in various types of cancers like the ovary, the breast, and the uterine. So almost they are involved in the tumorigenic process. So they are involved in the tumorigenic progression, such as the angiogenesis, apoptosis, and the invasion. All these enzymes are highly expressed, and we can easily detect for the diagnosis of any kind of cancer, any type of cancer. Then the COX-2. COX-2 are really play a very contributing role, especially to identify the inflammation in the body, or to identify the carcinogenesis, or to identify the apoptosis, or to identify the immunosuppression. So COX-2 is a very central key molecule, especially what it does is it acts as a precursor for various kinds of molecules like prostaglandins, thromboxanes, and prostacyclins. So the inhibition of COX-2 may suppress the cancer or may suppress the inflammatory reactions, but there are some of the disadvantages by the suppression of the COX-2. So there are biomarkers. It is a very good biomarker, especially in the progression of the tumors of various kinds of different types of cancers. And the fifth kind of enzymes is the dehydrogenases. Probably two dehydrogenases, mainly called as STH, sorbitol dehydrogenase, and the lactate dehydrogenase. They are involved in diagnosing or the prognosing about the variety of cancers. STH is more specific to prostate and the colorectal cancer, whereas the LDH is involved in the colon, the breast, and the oral and the lung cancer, as well the pancreatic and the prostate cancer. These all are involved in particular LDH diagnosis. So what are the disorders that are coming in the cardiac? So what are the enzymes involved in the cardiac disorders that we will see? So the creatine kinase is quite well known kind of enzyme, where it can detect the myocardial infarction. If there is a rise in the CK levels, that tells that there is some problem with the myocardial infarction or the muscular dystrophy, or if any muscle reactivity is there. And it also helpful in the diagnosis of hypertension and the kidney diseases. So CK is involved in almost both the cardiovascular, at the same time the kidney functionalities also. Actually, the kidney function and the cardiac both are quite linked, especially when we are dealing with the hypertension kind of things. So the next kind of enzyme is like glycogen phosphorylase. It is a biomarker for the cardiotoxicity and the myocardial infarction and the preeclampsia. So these are the conditions where we can use the glycogen phosphorylase as a diagnostic marker. Gelatinases, again, they are the early phase detection of the acute myocardial infarction. See, all the myocardial infarction or whatever the relevant to the cardiac, they all leads to the cardiac arrest. So they are simply leads to the heart attacks or the cardiac arrest. So we can detect priorly by these enzymes if anything such incidences can happen in the future. The next is like amylases. They are also potent biomarker for the detection of heart failure as well some of the kidney functions. We can also use them as a cardiac diagnostic markers. And finally, in the end, I would like to also comment about some of the other kind of what we say the applications of the enzyme catalysis. That is like the where else the enzymes are used other than the therapeutics, other than the diagnostics. The enzymes are used in almost everywhere in other industrials like the pharmaceuticals. Like you can generate the APIs. You all know possibly what the APIs are, active pharmaceutical ingredients. So to really generate the active pharmaceutical ingredients, we use the enzymes like nitrile hydratase, transaminase lipases, and the penicillin acidases. And even in the food processing units or food processing sectors, we especially use the enzymes like the trypsin, amylase, glucose, pectinase, and other kind of enzymes, so that they are involved in the production of the probiotics. They are involved in the production of the various variety of number of what we say the food products and the detergents, especially like protease, lipases, amylases. All these are meant for the stain removal or the removal of fats and the oils, all the cleaning purposing of things. The enzymes are involved, and the biofuels like cellulase, xylanase, and the lipase, they are involved in the production of the methyl esters and for the bioethanol production. So we use enzymes for the bioethanol production also. And paper and pulp industries, they also use these enzymes, especially for the generation of the fibers. I mean the improvement in the quality of the paper or the fibers. They utilize paper and pulp and these enzymes in industrial applications. So with this, possibly, so what are the things we try to understand today? What are the things we try to address today? So you can possibly define what the enzyme is and what the components are, and certainly you can tell some of the role of enzymes as a therapeutics, and we can address some of the applications. So we have seen the various type of applications, therapeutic applications, in the sense of like where the enzymes can exactly play the role in metabolic disorders, the cancer, cardiovascular, inflammation, like that, and the role of enzymes as the diagnostic markers. So in the liver, especially in the cardiovascular, in the cancer, we got so many number of enzymes which act as diagnostic markers. And I have also tried to show you other applications in the industries where the enzymes are extensively used. So with this, these are some of the prominent references what I have used. Other than this, I have also used some of the basic literature about the particular applications. So what exactly the bottom line? What I can say is not the therapeutic or not the diagnostic. Everything is linked. Almost every of the disorder or every of the disease is based on only on these three. I am not a doctor. Doctor, no need to tell. Possibly everywhere you must be right now, right today, you will be seeing this. A very good activity and a very good food and a very good sleep ultimately leads you to a very good immune response body. Okay, we can keep a bay of all these enzymes, all this stuff, all these tests, all this diagnostic, all this therapeutics, because majority of the diseases are only lacking of this. I think everybody certainly agree. You yourself question, I myself question, like how I am confident really doing all these three. No, Probably I may not sleep very completely, around 5 to 6 hours only, but every man, every person should require at least 7 to 8 hours of sleep. So this is mandatory. The diet, even the activity, whatever we do, it should be of somewhat a which should a very good way, so that we keep our healthy, we maintain our healthy lifestyle. So when we really maintain all the healthy lifestyle, possibly we can have we really keep away of all these kind of disorders or all this for a certain age extent. That's what we cannot avoid, but at least we can at least delay the things. So with this, I thank especially the organizers for providing me this opportunity, and I am the session is now for open for the question and answers. So if anybody can really go with the questions.
Thank you, sir. Thank you. Amazing. Thank you for your amazing lecture. It's
Thank
really
you.
impressive. The way you have to explain by giving some examples.
Yeah.
I enjoyed a lot, sir. Simply,
Thank you.
thank you, sir. Thank you very much.
Okay.
Now it's time for question and answers. Over to Pranati. Pranati?
Thank you, sir.
Okay.
Yeah.
Thank you, sir, for your excellent and informative session.
Thank you. Thank you.
Sir, we have some queries from participants.
Sure.
First question, what are the major risk factors for metabolic syndrome?
Yeah, as I have said, like metabolic disorders are basically because of the mutations. The mutations that do come in that particular enzymes. So whatever the enzymes, I have tried to make you understand like what is the reason, what is the deficient or the lack of the enzyme. So that enzyme is lacking its activity because of the mutation. So I'm not telling the mutation. Usually the mutation is the active sites of that enzyme, or the mutation leading to the protein conformational change. So usually the mutations are the one of the major factors for the disorders. The risk factor in the sense, the environment can play a role in making a mutation, or the some of the genetics, already hereditary genetics may have the role in having the disorder. So that's why I just lastly mentioned to have to really come across all the mutations. To really get away from the mutations, we need to mainly follow those three: a good food and good diet and good sleep. Why? Because the sleep links to every of the metabolism. The food links to every of the metabolism, and all metabolisms are integrated. Okay, the carbohydrate, the lipid, the amino acid, the nucleotide, everything are integrated in the body, and they do a very synchronized job. Okay, yeah, that can be the answer.
Yeah, thank you, sir.
Yeah.
Next question, why enzymes are used as thrombolytic agents, though we are having other medications in place of enzymes which produce that action?
Yeah, actually we have drugs. We have the surgery also. Actually, surgery is also one kind of dealing with the clots, especially the thrombolytic way. But what happens is, while in the surgeries, when you do the surgery, the clot can be removed by the surgery. But there is a chances of happening a clot again at the location of the surgery, or it's somewhere else there is a chances of the location. Basically the clot is happening. Why? What is the reason for the happening of the clot? Because of the lack of balance between the there is a problem of homeostasis between the clotting factors and between the clotting breakdown factors. So there is a not there is a gap of communication between them. So that problem exists every time. That problem exists almost every time once it happens. So there is every chance of clot formation every time. So what you are doing is you are using the enzymes so that to maintain the homeostasis. You are maintaining the homeostasis so that the no clot formation and no clot breakdown happens every time. So that's why enzymes are more preferable rather than the surgery or the drugs, which do the action of the clot, but there are chances of clot formation. Okay.
Thank you, sir.
Yeah.
Next question, Which enzyme is used to overcome immunogenicity and toxicity in humans?
This is probably a very broader question, like immunogenicity and toxicity. So immunogenicity and toxicity usually, see, that's what immunogenicity is somewhat relevant to the immune cells. The immune cells are leading to possibly the immune cells may be involving in the what we call inflammation, and inflammation leads to the other kind of pathways activation that ultimately leads to the toxicity of the cell. It should be, I mean, very specific, like what immune reaction you want to stop, or what toxicity problem you want to deal. Basing on that, possibly that enzyme you will be using. Enzymes are specific, right? They have their own targets. So possibly we should first of all understand what is the mechanism of the toxicity, or what is the mechanism of the immunogenicity. Basing on the mechanisms, when you try to understand the mechanism, you try to figure it out what molecules are responsible. Once you know what the molecules are responsible, now basing on the action of the molecules, you can address by using the enzymes. I hope you got the answer.
Yes, sir. Next question. How are the enzymes used as biomarkers of a disease?
Yeah, you, like I have said, like biomarkers, in the sense, if the liver is liver is having some disease, like a hepatitis, it do have, or liver is having some damage inside it. So it usually generates the high levels of the enzymes what I have mentioned, like immunotransferases, or the GCT. These are some of the enzymes where they are high volume amount of enzymes will be present in the plasma. Then you can what you can do is you can measure what is the quantity of the enzyme that has been expressed in the plasma. So that is a marker over there. So usually the enzymes are nothing but the markers. Okay, enzymes act as the markers in the disease. Yeah.
Next question. How can we demonstrate catalytic activity of an enzyme?
Catalytic activity, each function has its own catalytic action. So if, for example, the protease has one kind of job, the dehydrogenases has one kind of job. So it is very specific. And who defines that? Usually, how the function of the enzyme is regulated, or how the function of the enzyme is defined. That is only because of the sequence and what are the amino acids contributing for the enzyme action. So enzyme action is basing on the amino acid sequence of an enzyme, and probably the amino acids within the enzyme define the catalytic action. So every enzyme got its own kind of catalytic action. Yeah.
Next question. Which enzymes are majorly used for kinetic studies?
Kinetic studies, every enzyme has the kinetic study. Every enzyme has its own right kinetics. So not specific enzymes, but almost every of the enzyme should, as said, every enzyme should understand. I mean, we need to understand its kinetics so that we can really understand its stoichiometric balances, where actually they will take you lead to the understanding the entire metabolic function. Okay, so all the enzymes are important, especially to understand its kinetics. Yeah.
Thank you, sir. And that's it from my side. Tejasri, any questions from your side? You can unmute and ask.
Okay.
Thank you, Pranati. Good afternoon, sir.
Good
A
afternoon.
question by Kausar.
Yes.
Does phosphorylation of an enzyme affect its Vmax and Km value?
Yes. Yes. Any kind of bond formation or any kind of addition of the molecules to an enzyme will have an impact on its action, will have an impact on its function, will have an impact on its structural conformation, and obviously whatever you have mentioned, like the Vmax and the Km, they will also going to differ. Yes.
Okay, sir. A question by Rajesh.
Yes.
How long a restriction enzyme can be stored at room temperature?
Can be stored at the room temperature. Usually, majority of the restriction enzymes are are kept at 4 degrees centigrade or some of what, as far as my knowledge. I think a majority of the rDNA technology experimentations are done in the cold conditions, possibly. So room temperature may not that much suitable, as far as I know. Anyways, I'll just again reconfirm. I will myself. You also please try to do that. I'm not sure whether I don't think so. They work in the room temperature. Yeah.
Okay, sir.
Yeah.
A question by Archana. How
Okay.
can we determine the amount of damage in tissues?
Damage in the tissues, this again the same, like the enzymes reflect. Enzymes will shout. Enzymes will really get angered. Simply what I can say, student. So enzymes display their anger in the form of plenty number of volumes. Simple. So if there is a damage in the body, if there is a damage in the liver, enzymes get a lot of job to do to really handle the damage. Really, a very God blessing thing is liver does a plenty of job, especially in handling the toxicity. We every time whatever the food we take, certainly a small limit of the toxicity will be there. Whatever the junk food we eat out, but everything is handled by the liver. So a liver will show its response by activating its enzymes to really handle the toxicity. Yeah.
Okay, sir. Thank you. A question by Kumari.
Okay.
Any disadvantages for enzyme replacement therapy to treat adenosine deaminase deficiency?
The disadvantages in the sense what I have mentioned, like some of the enzymes may show the proteinaceous nature, they can be antigenic in nature, and some are very easily transported away rather than doing its job. So I'm not sure like adenosine deaminase exactly what how the enzyme therapy really works out, but there are disadvantages with the enzyme replacement therapy in almost every of the metabolic disorders what I have mentioned today. Almost they have to really go through the two conditions, two major problems. One is to avoid the antigenicity problem, and it should not be carried away other proteins in the plasma because it has to do its own job. Yeah.
Okay, sir. A
Okay.
question by Sharmila.
Okay.
Do targeted therapy kill cancer cells?
Yes, yes, that is targeted therapy really is a, I mean, by using what? By using what is a majorly important targeting therapy. So you can use the some kind of nanomolecules combined with the enzymes. You can use the drugs combined with some proteinaceous nature, or you can use the enzymes as a targeted. So definitely when you are targeting the cancer cells, probably you are not targeting the normal cells. That is the advantage. You use a monoclonal antibody tagged with your drug molecule, or monoclonal antibody tagged with your therapeutic enzyme, and exactly focus onto the cancer cells, not to the normal cells. That is what missing in the radiotherapy or the chemotherapy, where the normal cells also get damaged along with the cancer cells. Okay, that is a quite interesting part, the targeting therapy. Yes.
Okay, sir. Thank
Yeah.
you for your valuable lecture, sir.
Yeah, thank you.
Thank you, Tejasvi. Thank you, sir. That's all from queries from the participants.
Okay.
Now I invite Dr. P. Ravishankar Garu, HOD, Department of Pharmaceutical Analysis, Vignan Pharmacy College, to please speak few words. Sir, please.
Okay. Can you listen me, Pranati?
Yes.
Do you
Yes,
hear
sir.
me?
Yes, sir.
Okay, okay.
Yes.
Hello, everyone. I am Professor Ravishankar, HOD of Pharmaceutical Analysis. I am going to be thanking everybody for watching today's webinar in this moment. Okay. I must mention our deep sense of admiration for Dr. A. Krishna Chaitanya for his efforts and for delivering incredible exposure to the topic entitled Therapeutic and Diagnostic Applications of Enzymes. In fact, I feel like you have spent a lot of time to preparing your awesome presentation. So now role on enzymes in therapeutics and enzymes in diagnostics. So you have prepared PPT during this unexpected pandemic period, sir. As a matter of fact, you are a passionate and fantastic teacher.
Thank you. Thank
Okay.
you, sir.
Okay. Professor P. Srinivas Babu garu, Principal of Vignan Pharmacy College, and Devarakonda Ashok, Organizing Secretary, are here in this moment on the online webinar along with me. On behalf of Vignan Pharmacy College and all of you, it is our honor to present Dr. A. Krishna Chaitanya, Assistant Professor, Department of Biochemistry and Bioinformatics, Geetham deemed to be university, with this exquisite virtual certificate of appreciation. Please exceed it, sir. So accept it.
Yeah, thank you. Thank you so much.
Okay, it's okay.
Thank you.
Okay, awesome. Thank you. Welcome. And I want to thank everybody again for watching the VPC YouTube channel and Zoom meeting today. Keep your eyes out for upcoming webinars where you will go over the rest of the 2 webinars in this 1 week series. Okay, so just one last huge thank you to all of you. That's it for today's webinar. Over to Pranati.
Thank you, sir.
Okay,
Now
thanks a lot, Pranati.
I'm privileged to invite Dr. P. Srinivas Babu Garu, convener of the event, principal, Vignan Pharmacy College, and vice president, IPA AP State Branch, to address the participants. So please.
Thank you, Pranati. So, on behalf of Vignan Pharmacy College, we would like to appreciate Dr. Krishna Chaitanya, Assistant Professor, Geetham deemed to be University, for accepting our invitation and giving an exotic speak and lecture therapeutic and diagnostic application of enzymes. Is one of the important topic which may help more of the students of present need of therapeutics and diagnostics, which are need of the hour. And I hope this topic is enlightened all the participants, and some of the participants who are missed, they can go through YouTube and they can enlighten their knowledge. And if you have any doubts, you can ask the organizers. They can suggest the information to the speaker and they can bridge the gap. So on behalf of IPA AP State Branch and IPA Education Division and IPA, I urge to congratulate the HOD of the Department of Pharmaceutical Analysis, Dr. Ravi Shankar, and Organizing Secretary, Mr. Ashok, and the student organizer, Pranati, for doing this program a grand success. Thank you all. Thank you very much. Especially Krishna Chaitanya for sparing your valuable time with us.
Thank you, sir. Thank you.
Thank you. Thank you very much.
Thank you, sir, for your valuable words. Thank you, Krishna Chaitanya, sir. We are really privileged to have you here today.
Thank you, ma'am. Yeah.
Okay, thank you, Krishna Chaitanya.
Thank you, sir. Thank you, sir.
It's just awesome.
Yeah.
Okay, sir.
Yeah, welcome.
Okay, bye.
I thank all the participants for their enthusiastic role in today's session, and I request your support should be continued in the same way for the remaining 2 sessions also. Thank you all. And all the participants can watch live in YouTube or join through Zoom by tomorrow 11 a.m. sharp for tomorrow's session. It will be on organic synthesis, the essence for preparation of medicinally useful compounds by Dr. Afzal Basha Sheikh. Thank you all. Thank you, sir, once again for your presence today.
Thank you all. Thank you all.
Thank you, sir. Thank you.
Thank you. Thank you. Welcome. Welcome.
Okay, bye, Pranati.
Bye, sir. Thank you, sir.
Bye. Bye.